This is my NG tube skills video. The first thing I'm going to do is I'm going to check the medical record for orders, the type of NG tube to be placed, and the tube's purpose. I'm going to review the client history for any conditions that would impair the NG tube going in. I'm going to perform hand hygiene. I'm going to identify the patient with 2 identifiers, and I'm going to explain what the procedure is today. I'm going to put on clean gloves and prepare supplies. I am then going to place a pulse oximeter and monitor and measure the patient's vital signs. I'm going to assess the client's level of conscious, their ability to cooperate, and their ability to move in the correct position for placement. I'm going to assess the client's nares and oral cavity, look for a deviated septum, nasal surgery, inability to breathe well, and if the nasal opening is occluded or irritation with bleeding. I'm going to reassess their ability to cooperate. I am going to measure the estimated length of the tube to reach the stomach. I'm going to measure from the tip of the nose to the ear to the xiphoid process. For this demo, I will be using 45 as our marker. I'm going to put the distal end of the NG tube in some water-soluble lubricant and place a towel on the patient's chest. I'm then going to let the patient know the insertion is about to begin and ask them to extend their head back against the pillow. The patient will be in a high Fowler's position. I'm going to insert the tube slowly through the nares and the curved end point going down towards the ears. If resistance is met, I'm going to apply gentle pressure downward and advance the tubing. Along the way, we're going to check the back of the throat for coiling of the tube with a pen light. So I'm going to ask the client to bend their head forward, chin to chest, and swallow with or without water as allowed, and advance the tube with each swallow. If gagging or coughing occurs, I'm going to withdraw the tubing a little and allow the patient to rest and then continue again to advance. I'm going to advance with swallowing until the marker spot is reached. I'm then going to temporarily tape the tube to the patient's cheek. And we're going to then check the placement of the tube and ask the patient to speak. I'm going to inspect the posterior pharynx for presence of coiled tube. We will attach the catheter tip syringe at the end of the tube and aspirate gently back on the syringe to obtain gastric contents and observe color. If hospital policy, we will then test the pH of the aspirated contents and re-inject the aspirator or air bolus and listen with the stethoscope over gastric area for any swishing sound. Once confirmed, we will now anchor the tube to the nose. Doing that, I'm going to cut my tape into a Y formation, place it on the nose, and wrap my tape around the tubing to secure. We will fasten the end of the NG tube to the patient's gown using a clip or piece of tape. I'm going to keep the head of the bed elevated at least 30 degrees unless otherwise ordered, and attach the NG tube suction to the suction source and establish suction low intermittent setting unless otherwise ordered. I'm going to provide oral hygiene every 2 to 3 hours. I'm going to assess the patient's comfort level. I'm going to remove my gloves and perform hand hygiene. I'm going to place the call light by the bed and document the procedures and patient outcomes.